In response to Instagram posts, prompt to Copilot text to videoprectory.ai, not edit other than voice selection. Here is the clear, medically grounded review of amivantamab, covering efficacy and side effects, fully supported by the sources we just pulled. What amivantamab is: amivantamab, Rybrevant, is a bispecific EGFR-MET antibody used for advanced or metastatic non-small cell lung cancer, NSCLC, with specific EGFR mutations, especially exon 20 insertions. It is FDA approved in multiple first-line and second-line combinations. Efficacy summary: what the evidence shows. Overall effectiveness: a 2024 systematic review of 5 clinical trials, 1,124 patients, found progression-free survival, PFS, 4.3 to 8.3 months. Overall survival, OS, 10.2 months. Objective response rate, ORR, 30% to 73%, depending on mutation and combination therapy. First-line combination therapy. In the Mariposa trial, PFS improved to 23.7 months with amivantamab plus lazertinib versus 16.6 months with osimertinib alone. Overall survival also improved significantly. Median not reached versus 36.7 months. Real-world data. A 2024 multi-center real-world study found disease control rate 64.3%. Clinical response 45.2% in heavily pretreated EGFR mutant NSCLC patients. Key takeaway: amivantamab is effective, especially in EGFR exon 20 insertion mutations and in combination regimens. It improves survival and response rates compared to older EGFR therapies. Side effects. Most important section. Amivantamab has distinct and sometimes severe side effects, especially early in treatment. 1. Infusion-related reactions, IRRs, occur in 42% to 78% of IV patients, only 13% when given subcutaneously. Symptoms may include fever, chills, dizziness, rash, or breathing difficulty. 2. Skin reactions, very common. Rash, up to 85%. Dry skin, acneiform dermatitis, paronychia, nail inflammation, 50% of patients. These often appear within the first 2 to 4 weeks. 3. Lung toxicity, interstitial lung disease. Pneumonitis requires immediate medical attention. 4. Blood clots, deep vein thrombosis, pulmonary embolism. Patients may receive prophylactic blood thinners. 5. Eye problems, keratitis, uveitis, blurred vision. 6. Gastrointestinal nausea, 36%, stomatitis, 28%, constipation, 24%. 7. Edema and metabolic changes, peripheral edema, hypoalbuminemia, up to 83%, electrolyte abnormalities, AG, K, Ca. 8. Serious skin reactions, rare but dangerous, toxic epidermal necrolysis. Clinical interpretation. Based on the evidence, amivantamab is highly effective for EGFR mutant NSCLC, especially exon 20 insertions, and even more powerful in combination therapy. However, it carries a high rate of infusion reactions, skin toxicity, and metabolic disturbances that require close monitoring. Patients typically receive pre-medication, steroids, antihistamines, antibiotics for skin toxicity prevention, blood clot prophylaxis, regular eye and lung monitoring. If you want, Lee, I can also break down how amivantamab compares to osimertinib, lazertinib, or TKIs. Which patients benefit the most? What side effects are early, late, or dose-related? How to interpret this for someone you know. Just tell me the vector you want to open next.